Okay. All right. Hi, everybody. I'm Tricia Dunlap with Dunlap Law. We are a small business law firm located in Richmond, just east of downtown in Rockets Landing. And Dunlap Law is about 5 years old now. And I have a whole host of small to mid-sized business clients in Richmond and also in DC, where I'm also a member of the bar. So I'm happy to be with you today. As you may or may not be aware, in July, the Commonwealth created a bunch of regulations around COVID-19 workplace safety. And these are binding regulations that employers in Virginia have to comply with. They went into effect on July 27th, which was a mere 12 days after they were approved. So business owners had about a week worth of business days to understand the regulations and then be ready to comply with them, which as an attorney, you would think I would be able to read the regulations and be ready to go pretty quickly. And that was not the case because they are dense and they are vague at times. So it was a high bar. I'm gonna go ahead and share my screen. I've got a presentation here and let me see what I need to do here. Sorry, we were experimenting with screen sharing earlier and now one participant can share at a time. Let me see if I can. Okay, here we go. Okay. Are you all able to see my presentation? Yes, I'm seeing thumbs up. Okay, yeah. Great. All right, so we'll jump right in. Come on, slideshow. So first of all, who is affected by these regulations? Every single employer in the Commonwealth. If you have even one employee, then you are subject to these regulations. You've got to comply. That includes if you've got one part-time employee, if you have contract employees or temp employees, it applies to you. If you have an agency that sends, perhaps the employees are employees of the agency, but they're provided to your business and they're at your work site, these regulations apply to you. Maybe it's just you and a partner, well, these regulations apply to you because you have a partner. So they're very broad. There are very few employers in the Commonwealth who will not be subject to them. Even if you have employees who are literally provided by another business and maybe they're, seconded from that business to your work site, then these still apply to you. Also, if you're a commercial landlord, some of these regulations apply to you. You're going to have cleaning of common area duties and notification of other tenant duties. I'll talk more about that in a minute. Also, part of the regulations is a rather strongly worded no discrimination for any reason clause. And this means that your employees are empowered to raise concerns about how you handle COVID-19 workplace safety. They can raise those concerns with you, with anybody else who's perhaps, a manager or an agent for the business. But more seriously, they can also raise their concerns with the general public by posting on social media. You cannot discriminate for any reason against an employee who asserts their rights and the protections under these rules. So if you get into a situation where you have an employee who posts on social media about your COVID-19 workplace safety measures, then the very first thing you should do is pick up the phone and call a lawyer. Whether it's me or another qualified business lawyer, you need a lawyer to help guide you through that, because the risks of you triggering either an enforcement action or a lawsuit because you have either retaliated or discriminated against that employee are fairly high. Also, employees can refuse to perform a work task if they consider it too dangerous. Now, there are a lot of caveats to this. There are other provisions in Virginia law that if an employee says, no, I'm not going to do that work task, there are certain things the employee must do in order to be protected, and also refuse to work. But nevertheless, they can do that. So again, that's a scenario where you're going to want to call a lawyer. And then finally, there are other Virginia laws, such as the Virginia Values Act, which became law July 1st, that provide protection to employees who exercise any other rights under Virginia law. So there's an overlapping web of legal issues around these workplace safety rules. Fines can range from $13,000 if you're out of compliance, but maybe you were trying and you didn't know it. You might even not get fined, but you still might get investigated, which can also be expensive. So $13,000 on the low end. If you are willfully out of compliance, then the fines can be as high as $130,000, and those can multiply. So this is, unfortunately, it's no joke. So here are some of your responsibilities. This is the big picture related to your responsibilities around employee health. And now we're going to break it down a little bit. First of all, you need to have policies and procedures that help you exercise what's called reasonable diligence around your employees' health. Your employees need to have systems that you have created and communicated to them that allow them to report if they have symptoms of COVID-19. Report if they've got a positive test result. You've got to have policies around when and how they return to work under either of those scenarios. And your duties trickle down. So if you have perhaps a subcontractor that you're sharing space with or that you're working on a project with, you have to make sure that your subcontractors also have appropriate policies for their employees who are on a work site where you have basically control of that work site. There are two categories of employees who may not come to work. The first category is a suspected sick employee. This is someone who's got symptoms of COVID-19, but maybe they haven't had a positive test, or they haven't had a positive test, but there's no alternative diagnosis. So, they don't have the flu, they don't have, rotavirus or any of the other viruses out there, but they've got all the symptoms of COVID-19. This person may not remain at work and they may not come to work until they have been qualified to return, which I'll get into in just a second. The next category is someone who is a quote sick employee. That's someone who has had a positive test within 14 days of being at work. So that's actually a pretty big window if you think about it. If you have people who maybe aren't on site all the time, but they call you on a Wednesday, they call you today and they say, hey, I just got a positive test for COVID, and they were on your work site, 14 days ago, then that would trigger this part of the rules. That employee may not remain at work. They have to leave immediately. You should have some masks on site so that you can provide them with a mask if they, maybe they need a ride or whatever, they can't just walk out the door. They absolutely cannot come back to work until they're cleared. Within 24 hours of learning that your employee has had a positive test, you have a sick employee, you've got to notify the Virginia Department of Health. You also have to notify other exposed employees. Well, pause to think about that for a minute, okay? In our scenario I just sketched out, 14 days ago you had an employee on site, and today you learned that they were positive, they have a positive test for COVID. You've now got to go back and figure out who else was on site while they were on site, and did those people overlap? Were they in the same conference room together? Did they share common space together? All those questions. So you just need to be ready for that. You also need to inform other employers who are in the same building as you. So for example, I share my building with another law firm, and if one of my employees, or if I were to have a positive COVID test, I would need to inform the leadership of the other law firm so that they can then inform their employees. You've also got to inform your building owner. So if you don't own your building and you have a commercial landlord who controls that building, then you've got to inform the other landlord. And here's where, if you're a commercial landlord, you then have to notify other tenants and also perform common area cleaning. So you need to be ready to do that. Now, one of the things that isn't entirely clear, and this could be subject to the lease you have with your landlord. Let's say you have an employee who is a sick employee under these rules here. You've got to clean the areas that they were in. If you can wait 24 hours to clean, then you should. But if you can't wait 24 hours for cleaning, then it's okay to clean right away. The rules are not specific as to who has to clean. So whether you have to clean, your business has to clean, or whether your landlord would have to clean your space would be an issue addressed potentially in your lease. So that's just something to consider. But you need to be ready to have a cleaning crew that could come in within 24 hours notice. Then you've got to have a protocol and a policy in place for when that either suspected sick employee or a sick employee can return to work. There are two forms of clearance. Number one is the symptom-based clearance, and that's where they go 3 days without a fever, plus 3 days of improved respiratory symptoms, and that's without any, drugs or, steroids or, whatever other drugs they might, or pharmaceuticals, I should say. Pharmaceuticals they might be taking to help them with symptoms. The improvement in their symptoms has to take place without medication. So for instance, nobody should be back at work if their symptoms have abated only because they're on a steroid. They have to have 10 days since their first symptom or since they had a positive test, since their positive test. If you consult with a health professional around whether or not it's appropriate for a particular employee to come back to work, then you would be deemed to be in compliance with the rules. So that's something else you may want to consider, is to, try to find a health professional that could serve as almost a consultant to your business. The second type of clearance for return to work is a test-based clearance. And that requires 2 negative tests 24 hours apart, plus no fever, plus improved respiratory symptoms, again, without medication. Moving on. This next part I'm going to talk about, and don't worry, I will break down this slide. This next part I'm going to talk about is probably one of the most burdensome requirements of these rules. Because again, as I said at the top of our presentation, these rules apply to every single employer in the Commonwealth if you have even one employee, even if they're part-time. Frankly, even if everybody works remotely, you still have to do most of this in here. So you are required to perform what's called an exposure risk assessment. Now here's what that means. First of all, you have to consider every single job task. Now, that doesn't mean that you're considering, the work environment as a whole. It means you have to think about what are the job tasks that each employee performs. That's the beginning of the exposure risk assessment. And then you've got to do the risk assessment for each job task. You have to consider, there are 9 factors that you should be considering, and they're in the regulations. I have a comprehensive guide to this that set out each of the 9 factors that I'm happy to share with everybody so that you can refer to that. Plus, you have to consider whatever issues might be unique to your workplace. If there's some issue around your workplace that, maybe other workplaces might not have, then you need to consider that as well. Here's what you need to be thinking about. The things to consider. What are the modes of transmission? You've got to think about asymptomatic modes. You've got to think about the possibility of droplets and, all of this reason we're all wearing masks everywhere. But you also have to consider the possibility of aerosol or airborne transmission, which the CDC just recently this week came out with guidance informing us that there's evidence that it is transmitted through aerosol and airborne means. So as you think about every job task, you've got to consider how each of these potential transmission modes could interact with that job task. Okay, this right here is a landmine of conflicting legal obligations. The rules require you to consider employee risk factors, and the rules specifically instruct you to consider your employees' pre-existing medical conditions. That could be a significant legal risk for you because there are other Virginia laws that penalize employers for considering certain medical conditions. For example, the Virginia Values Act, which became law on July 1st, prohibits using an employee's pregnancy for any employment-based decision whatsoever. So if you're not allowed to use an employee's pregnancy as you consider their job tasks and their risk factors and perhaps an adjustment of their duties or their schedule in order to protect them from COVID, right? And yet you're not supposed to do that under the Virginia Values Act. So this is, to my thinking, between this and the potential for an employee to post on social media and then create some sort of discrimination claim against you, these are the two biggest risks of these rules. The other thing you're supposed to consider is if you have an employee that is moonlighting, and perhaps they're moonlighting in a work setting that has a higher risk factor than your work setting, that's something you also are supposed to consider in your exposure risk assessment. Fun times, I know. All right, the next thing to consider are the necessary controls to mitigate the risk of COVID. First, there's PPE, and PPE doesn't include masks. PPE includes things like respirators, and by respirators, I mean the N95 respirators that, unless you're medical personnel, you can't even get nowadays, and sometimes they can't get it either. PPE includes, the hazmat type suits and other things like that. So most employers are probably not going to need PPE as part of their controls, but you have to consider it. You also have to consider engineering controls, things like plexiglass screens and other like physical infrastructure that could protect some of your employees. Then you've got to consider a whole host of administrative controls. Should you reduce the number of employees on site, have people working from home as much as possible, for example? If you have a common area where people eat lunch and it's not possible for them to eat at their desk, or maybe their desk is in a common area, you might need to plan shifts in that common area so that you control the number of employees that are in there at any one time, pull tables out of there or whatever it might take so that you don't have as many people in there as you do now. Also, if you create shifts for your common areas, you absolutely must ensure that that common area gets cleaned in between shifts. You can either have employees do it, assuming that you have provided them with EPA approved cleaning materials and trained them, or you can hire a cleaning company to come in and do this, but then the cleaning company's got to come in, between each shift. So, but either way, that common area has to be cleaned in between use by employees. You've also got to institute social distancing to the greatest extent possible. The cleaning duties are pretty significant. If you have employees who are interacting with the general public and, like a cashier, then they need to clean their station using EPA approved materials in between each interaction with the general public. Well, I don't know about you, but the last time I was in the grocery store, the cashiers were not cleaning, you know, the pin pad and the keep and all of that in between me and the person in front of me or behind me. That's the level of cleaning that these rules, as they're written, seem to require. Whether or not the Department of Labor and Industry will actually enforce it to that level of diligence is an open question, but that's how the rules are written. Also, if you have employees who share a vehicle perhaps, or they share tools at a work site, they have to clean the tool or the vehicle in between, you know, before they transfer it to another employee. Finally, it is not enough for employers to provide the cleaning materials, train their employees on how to use it, and adopt policies. You've got to enforce this. Even if you've done all those things, even if you have provided the cleaning materials, trained your employees, retrained your employees, and adopted the right policies, if you've got some knuckleheaded employee who just doesn't do it, then you are still potentially liable under an enforcement action. So one of the things you've really got to consider is whether or not you want to retain an employee who has been trained and trained and trained, and they are still not doing it. That person is creating liability for you every single time they fail in that responsibility. So that's an important thing to think about, is that knucklehead factor, as my dad would put it. All right, there are 4 categories of risk, and I'll break this down for you. They're very high, medium, and low. Almost all employers are going to fall into either medium or low, but we'll touch on the very high and high. A very high risk employer, that's someone, or a very high risk job task rather, that is someone who is performing a job task that is creating aerosols or droplets from a person who is known to be sick with COVID or suspected. So an example would be if you're like intubating a COVID patient, or if you're handling medical samples from someone who is known to have COVID or suspected to. So this is a pretty limited, I imagine nobody on the presentation today has job tasks that are in that category, or if you are, you're probably already in compliance with all this. The next category down is a high risk, and that's someone who's providing non-aerosol producing healthcare for a patient who has COVID or is suspected to have COVID. And this could be, you know, maybe home health, or, you know, even physical therapy, or, you know, other medical procedures that don't produce the aerosols, but those procedures are done on someone who's sick or suspected to be sick. The medium category is where most of you are going to fall. And that's, for example, a bus driver, somebody working in a daycare, somebody working in a retail establishment, in a restaurant. These are, the medium category has exposure risks where people are working closer than 6 feet to one another. So for example, one of my clients is a pizza parlor, and they've got, you know, 6 to 8 employees in their relatively small kitchen at all time. And those employees cannot be 6 feet away from one another. So that right there, even with masks, you still are going to be in the medium category. That is unavoidable. If you fall into the medium category, then there are certain controls that these exposure risk assessments have to be written, and your exposure risk assessment has to detail the controls that you have verified are in place. So if you're listening to me right now and you're thinking, oh my goodness, my employee job tasks are all going to be in the medium category, or most of them are, you've got to have a written exposure risk assessment where you have gone down and basically audited your workplace. You've got to look at your HVAC system to make sure it meets certain criteria. You have to institute employee screening before every shift. So you should be taking your employees' temperatures as they show up to work before each shift. And you know, it's an open question. Are they on the clock for that or not? Right? Do you know, for my pizza parlor clients, do they make their employees stand out on the sidewalk and take their temperature before they let them come in the building? Or do you let them come in the building before you know, and take their temperature once they're inside? So, you know, you can see where each of these scenarios opens up a bit of a Pandora's box. You should institute remote work, staggered shifts, reduced employees on site, virtual meetings, all of those things as much as you possibly can and still perform your business functions. You absolutely must have one of these three, at least 6 feet between people. If that's not possible, you've got to have at least masks. Or if the risks are sufficiently high enough, then, and this is where the rules are really vague, right? Sufficiently high enough, well, what does that mean? I'm sorry, we don't know. Not helpful, I know, but if the risks are sufficiently high enough, then you've got to have PPE. If you determine that PPE is necessary, you've got to determine what type of PPE. You've got to fit it to each employee. You've got to entrain the employees in its use and how to wear it, how to make sure it's fitted properly. You've got to provide the PPE, and then you have to, just like the cleaning, you have to make sure they're actually wearing it. You know, it's not enough to just have everything in place and tell them to wear it, have a policy in place. You've got to make sure they're doing it. The rules do have exemptions for people who cannot wear masks for medical reasons or for religious reasons. If you have an employee who can't wear a mask for religious reasons, then the Department of Labor has an exemption possibility. It's not really clear how that works, whether the employee has to apply for that or whether you do. But at any rate, even though they're exempt, there's nothing in the rules that says the employer won't be liable for that employee not wearing a mask. So that's a bit of a problem. Then additional controls that you need to consider, whether or not you can add physical barriers like the plexiglass screens, and then whether you can have delivery, curbside, you know, that sort of thing. Shoo. Next is the low risk category, which, you know, anyone in perhaps professional services, you may have a workplace where the job tasks fall into this. And this is typically remote workers, or it's people who are in a building where, you know, people can be 6 feet or more apart from one another. And then you're in the low risk category. So I'm actually gonna unmute everybody because I've given you like a fire hose of information. And before we move on, I just wanna see if there are any questions. So let me see how I unmute everybody. Okay, I will allow you to unmute yourself. How about that?
I've got a question.
Yes.
Actually, it's more of a statement than a question now that I've listened to what you've said.
Yeah.
I'm thinking about all the businesses I come in contact with for various reasons, whether it's frequenting or doing business with them. I virtually at this point know no company that I have ever seen since this whole thing started that would be in compliance. None.
I completely agree with you.
I mean, so which says to me, this thing may turn out to be a political thing. Those people that they want to come after, if they don't like you, they can do that. And the ones that they do like, they can leave you alone.
That's a possibility. I think the other risk here is that if you have a work site, or, you know, some businesses have an employee demographic that can be kind of challenging, right? Maybe there's high turnover, or, you know, maybe it's folks who are, like one of my other clients, for instance, is a commercial cleaning company, and they're always struggling with finding employees, right? And I think one of the biggest risks out of this is that an employee or employees will complain about your safety measures to the Virginia Occupational Safety Hazard, to VOSH, which is, you know, Department of Labor and Industry. For that reason, I very much urge all of my clients to, at the very least, do as much of this as possible and to communicate to your employees all the time about what you're doing to keep them safe. I think if you have a body of employees where there are a fair number, where there's a lot of grumbling, right? I'll just be candid. If you have unhappy employees who feel unsafe, I think your vulnerability to a complaint lodged by your employees with the Department of Labor is higher than other employers. And that complaint will kick off an investigation. So that's the other risk.
Can I ask you another question?
Sure.
Have they written into the law, number one, when vaccines come into play, if your employees all have had the vaccine, have they written into the law if your employees have the antibodies because they've already had the disease and survived it? Is any of that in there as curtailing requirements because of those two factors?
So these are what are called emergency temporary standards, and they went into effect at the end of July, as I mentioned, and they sunset. There are a couple of, they could sunset on any one of three instances. Number one, if the Commonwealth issues permanent safety standards, which they're working on right now, I'm sad to say, that would cause these emergency temporary standards to be superseded. Or 6 months after their effective date, so that would put us, into January, they would sunset. Or if Governor Northam, rescinds his executive order, or the executive order that created, the emergency around this, if that, is withdrawn or expires. So under those three circumstances, these emergency temporary standards would be null and void. I will tell you that the Department of Labor is right now working on permanent standards, which I was talking to some colleagues last night, and they were saying, I've been trying to track this, but quite frankly, I've been so busy, I haven't had time to track it as closely as I wanted. And what I'm hearing is that the permanent standards look an awful lot like these standards. So that's a problem. As far as the antibody tests go, the return to work protocols that I was talking about earlier, where you could either have test-based or symptom-based clearance to come back to work, the rules expressly say that antibody tests are not, you cannot use an antibody test to clear an employee to return to work. So that's not useful. Any other questions on the exposure risk assessments before I move on?
I do have one other one.
Okay.
How do they handle the issue? For example, I'm in quarantine right now because I have been exposed to someone who tested positive with no symptoms. So I'm in quarantine for 14 days and I will be tested on Friday. But what happens with other employees that I may or may not have had contact with, or other clients before then? I mean, is it just for people that have tested positive that you need to be so careful about, or is it just with the contact, or how does that work?
Well, if you look at the criteria for, there are two criteria for employees that would trigger a notification requirement. And one is if you are in the suspected sick category, and the other is in the sick category, right? Well, we can cross off the sick category because you have not had a positive test, and the sick category is dependent on a positive test. Okay, so you don't fall into the sick category. The suspected sick category is the other one that would trigger notification requirements, and that would require you to have symptoms. So if you yourself do not have symptoms of COVID-19, then you would not fall into the suspected sick category, and the notification requirements would not be triggered. Does that help?
Yes. Now, so these rules, are these federal rules? Or
No, these are Virginia rules.
These are Virginia rules, and they were come up by the Department of Labor.
Correct.
And since they were enacted in July, have they already started? Have there been infractions? Have they started penalizing? Has anyone stepped forward?
So it takes time for any kind of investigation under these rules to kind of work its way through the system and result in a penalty. Because the first thing that happens, like let's say there's a scenario where an employee thinks that safety is inadequate, and so they report you or an employer to Department of Labor and Industry. And then Vosh would send you a notification, hey, we've had this report, we're going to come investigate. And then they would literally like show up and start investigating and interview employees and, you know, all of that. And it would take time for all of that to kind of work through the system before it resulted in any kind of fine or penalty. And so I personally don't know of any penalties that have been levied under this. I also don't know if there are any investigations that have been kicked off under this, but then full disclosure, in the last 3 weeks, I've had a couple of clients with very high demand. So I haven't had time to go check either. So that is something I can check on, and then I'll report back to Kimberly, and she can maybe send out an email to everybody with a little update on that.
A few weeks ago, prior to the governor going into quarantine, he did they did come out and say there were a couple of cases being investigated at this time.
Okay, good.
So,
see, you're more up to date than I am. Good job, Kimberly. All right, any other questions?
Just one
Hey,
quick,
Tricia.
you mentioned you're recording this.
Mhm.
Is this, can we get this whole presentation in a video form, Kim, that we'll be able to show our employees or our managers or whomever that we can
There's
use
a lot
as a
of-
reference?
Yeah, there's a lot of different things that we have put together that will be coming out after this video has been, after this Zoom meeting's done. But we'll get you taken care of, I promise. Yep.
Okay, I'm thinking more about the video itself.
Yeah.
Just the presentation spoken
Mhm.
is more valuable than the slides. No offense, Alicia.
Oh, no, that's
Tricia.
fine.
But what your
I
impact
keep
on
my
what
slides
you're
with just, you know, a talking point or two, because a slide full of words is awful. In my
Right.
humble opinion.
Oh no, they're great, but what you're saying has so much impact that I'd like to be able to hear it again when I can start saying, okay, I remember what's coming. I want to write that down.
Right,
Yeah.
gotcha.
And
I
then I've
also
got
have-
partners
so-
in other businesses. I'd like to hear it too.
Gotcha. So the document that has all the rules in it is, you know, 30 some pages. And I distilled that down to what I think is a 12-page guide. And I believe that, Kimberly, did I give that to you to distribute to everybody?
You did, and I did email out one of the forms earlier with the link to this Zoom account, and then after everything's done and I have the video back, we'll go ahead and I will be resending out a lot of this information along with the Zoom video. So
Great. And it's also on my website, which is dunlaplawplc.com. We have a whole page of COVID-19 resources, and I've done some videos on this too. One of which is almost more of a rant than anything else. But
Could you say that website again?
Dunlap Law, P as in professional, LC.com.
Thank you.
And I have a slide at the end that'll have that information as well.
Okay, thank you so much.
You're welcome. Was there another question? I thought somebody else was trying to chime
There's
in
some
there.
questions in chat.
Oh,
Oh, I had one.
And I have a quick one.
I just wanted to ask you, I'm not sure if I missed it, but if your business is in a low risk category, do you still need to have the exposure risk assessment written up?
yes.
Okay.
How about that for a
Yeah.
short answer? In part
That's good.
because the only way you would be able to conclude that your business is in the low risk category is if you have done the assessment.
Okay,
Right.
thank you.
Yeah.
we
Tricia,
also got one from Darlene who was asking, she's got a plumbing company, so she's like Stan, she goes in and out of businesses and tenants. And how do you know, she's wanting to know how can they prevent their client, their personnel from getting sick when they go into these places that they don't know if there's what's going on in there.
Right, right. That's almost certainly going to fall into the medium risk exposure assessment. And you're going to want to make sure that, for example, that you provide your employees with a wide variety of cleaning solutions and, you know, wipes and things like that, so that you probably have shared vehicles and shared tools. You know, you may have, you know, you've got employees who are like going into somebody's bathroom, for instance, in their residence, And you may want to make sure they have enough cleaning supplies that they can go in and maybe do a wipe down of whatever areas they're going to be touching. And something to be aware of is that the cleaning solutions have to be solutions that are on the EPA list of approved solutions for COVID-19. And then your employees have to be trained in how to use them. So for example, you know, we're all familiar with somebody will take a wipe and then they'll wipe down the little pen terminal at the register or whatever. Well, some of the cleaning solutions actually require what's known as dwell time, where you have to like apply it and then let it sit for a minute before you touch it and wipe it for it to be effective against COVID. So you need to get familiar with the manufacturer's instructions for that cleaning solution and then train your people on it so that they know how to use it appropriately. And then, you know, you're going to want hand sanitizer by the gallon for everybody, you know, and it's especially tricky to do an exposure risk assessment when, I mean, really technically for a plumbing business, you have thousands of work sites, right, over the course of a year. And I think you would probably need to do an assessment based on what is typical, right? I mean, you're always going to have outlier possibilities, and it could be that you want to think about, you know, perhaps what kind of work site would I allow my employees to refuse to serve? So for instance, set criteria around, like, if they get to somebody's residence and, you know, certain facts are readily evident when they get to that residence. You know, maybe there's somebody that's sick and maybe even somebody says, oh, you know, my mom has COVID-19 and I need you to come in and fix my toilet. Nope, not doing it, right? And you just reject that client at that time. So you might think through some criteria for the outlier atypical situations that would protect your employees.
Is it legal for us to ask when they call in for an appointment if anybody has been subject to COVID-19 or had a test in the last 14 days? What
Yes,
the result?
that's legal. And you could actually, I don't know if you've been to the dentist or been, you know, there are a lot of sites right now that will screen people before they let you to come in, right? And so, you know, you could even just copy what they're doing, basically. And, you know, has anybody had a positive test within the last 14 days? Has anybody had symptoms? Anybody, you know, had a fever, things like that, and just go down the list of questions.
Okay, thank you.
Yep.
Tricia, I have a similar question. I have independent contractors, I have no employees, but they are going into individual homes. They're meeting with the clients, and I've been requiring that we're telling them that they'll be wearing masks. They're required to wear a mask. I have one that's going to a dog who gets kind of scared when she sees her with the mask on, so the owner has asked her please to come without the mask. In most cases, they're not really dealing with the owner, they're dealing with the pets. They were all told that they'd have, you know, the antiseptic wipes and cleaning stuff. They've all provided their own, so they're fine with that. I haven't been totally relaxed about it. I've been certainly informative about it and concerned, but I'm just wondering should I just consider them all as if they were employees and do the same thing as if this is a medium exposure?
I mean, that might not be a bad idea, just to protect yourself. And just to show
I
that
care about my employee. I care about my independent contractors too, but they're all pretty responsible people and pretty responsible also, I think, about their own hygiene or whatever. So.
Right. Well, I mean, you know, technically, if they're independent contractors, then you don't have employees and you wouldn't be subject to these rules. But, you know, it wouldn't necessarily be a bad idea to have at least some policies and procedures in place that are aligned with this.
Okay.
So also, for what it's worth, the Department of Labor and Industry has a bunch of templates and things on their website that you can check out. I've also cross-listed them in my guide. There's a link that'll take you right there to those. And I think I gave them to Kimberly too to hand out. So you'll be getting all of those. The templates do help. So for example, there's an exposure risk assessment template that Department of Labor and Industry created that we'll provide to you as part of the packet. And that helps kind of walk you through a lot of these things. that's not to say it's not still confusing. So I've been helping clients do their exposure risk, like they'll do the exposure risk assessment and then they'll send it to me and I'll look at it. I'm like, okay, no, that's not quite right. You know, we got to do it this way. And so it's still can be confusing, but the templates do help. Okay, I'm gonna go ahead and move on because unfortunately we still have a lot to cover. Next up, some of you will have to have what's called an infectious disease plan. This is required if you have job tasks that fall into the very high category, the high category, or the medium category, and you have more than 11 employees. Now, here's part of the vagueness in these rules. What if you have 20 employees, but you have 3 work sites? And you know, you have 5 employees at one and 6 employees at another, and then 9 employees at the third, right? Well, you've got more than 11 employees, but they're not all at the same work site. So do you have to have this plan? We don't know. So this is where like additional guidance from Department of Labor is necessary to fully understand this. But at any rate, this is a required plan if you hit any one of these 3. You absolutely have to have at least 1 employee who participates in the creation of this plan. The plan has to have a description of all of your infection containment measures. So, you know, all of the things that you're doing to try to limit exposure. You have to have sort of what if plans in place for if your supply chain is disrupted, if employees cannot report to work, how are you going to cover their work shifts? This to me is where, and this is my opinion here, but this is where the Commonwealth has crossed the line into telling business owners how to run their business, not just keeping employees safe, right? Like, why do I have to have a plan of, you know, why are you requiring me to have a plan related to managing my supply chain if there are disruptions? Right? Like that's my job as a business owner to figure out if I need that. Don't tell me I have to do it. But sorry, rant over. You've also got to have a PPE plan. And this can be a little frustrating here because what if you don't need PPE? You know, what if your risk exposure assessment determined that you don't need PPE? So there's some contradiction there. Any written policies and procedures that you've adopted around COVID should be in your plan. And then if you have other businesses with employees on your work site, then you've got to have in your plan an explanation of how you're going to ensure that the other businesses are also in compliance. Yeah. So it's not just you complying, you've got to have a plan for making sure that other businesses are also complying if their employees are at your work site. Yeah, great. Moving on, let's talk about training. Training is required. If your risk assessment concluded that all of the job tasks fall into the low risk category, then there is a 1 or 2 page handout that the Department of Labor has created that you can provide to all of those employees. So if you've got people, you know, remote working or whatever, you need to make sure that you distribute that handout. And then of course you need to have everybody sign off that they got it. So you need that documentation that you've trained them. You've got to train people on the signs and symptoms of COVID, on the policies and procedures that you have adopted around COVID. This one is really frustrating, this next one. You've got to train people on PPE and its appropriate wearing and use adjustment and all that stuff. This is true even if your risk assessment concluded that you don't have to have PPE. Now, that's what the regulations say. The regulations don't provide an exemption if you've concluded that PPE is not necessary. So, you know, it doesn't say, for example, if PPE is not necessarily necessary, you don't have to train on that. The regulations do not say that. I wish they did, which means that you have to train on PPE in order to kind of check the box on all the compliance issues. That said, if you are in compliance with everything else, this is probably not something that would result in a big fine or whatever, but it's something to just be aware of. You have to train your employees on these emergency standards. You have to educate them on these standards, including the non-discrimination protections within the standards. So you have to inform your employees that they are protected from discrimination if they exercise their rights under these standards. You also have to train them on your infectious disease plan, if you had to create one. Then you've got to document your training. When did you train them? Who got trained? They have to sign off on it. Who did the training? All of that stuff. Then finally, there's the retraining. You have to be ready to retrain your employees if the facts and circumstances change. You know, if we learn new things about COVID-19 and how it's transmitted, then you might have to do like a little mini retraining around that. If you've had to change your infectious disease plan for any reason, you might have to retrain on that. And then of course, there's again, you know, my dad's phrase, the knucklehead factor. If you have an employee who you notice is not performing the cleaning tasks, or they're not social distancing, or they're not wearing their mask, or they're, you know, in the common area when it's not their turn or things like that, you've got to retrain them. And if they still don't comply, then you've got to give some serious consideration as to whether or not you want to retain that employee, because you are still liable as an employer for their lapses, even if you've done everything right and the knucklehead just doesn't get it. So that's part of what you've got to consider too. I think that's it. Let's see if that brings up the last slide. Oh no, I had all these broken out. Okay, that's the end of my presentation. Do I have any more questions? Wow, that's good news, I guess. Or maybe
Cynthia
everybody's
was
so
wondering.
overwhelmed.
Cynthia was wondering about contingency plan, how to start wording that contingency plan. Or I thought I'd seen something that allowed them like a template for it, but I don't remember for sure.
Yes, and that's where I would start with the templates from the Department of Labor.
Okay.
And that they have an infectious disease plan template. But I'll just say one of my clients, which is, it's a very sophisticated client. They're a professional services firm. So these are highly educated people. They use the templates and then they sent them to me for review. And let's just say there were things they misunderstood. So, you know, it wouldn't be a bad idea to have an attorney look it over.
Hey, Kim, back to my original question. The actual presentation we just listened to, we're going to have a recording of that available to us? Perfect.
Yep.
Wow. We better hope that they hurry up and get a vaccine before they really get into this heavy. Because nobody's in compliance.
Well, so the genesis of these regulations, I don't know if you recall back in the late spring, early summer time period, there was quite a bit of news coverage about the hazards of basically it's chicken processing plants on the Eastern Shore and then out in the Shenandoah Valley area. And, you know, many of them became hotspots because by and large, those employers were not really instituting a lot of safety precautions around COVID for their employees. And that is what created the groundswell of demand and support for a statewide standard, largely to address the lapses of those employers. And, you know, part of my concern with these standards is that they've basically taken in a situation where what we really need are standards that are rather surgical and precise and perhaps adapted to different employer sizes and capabilities and things like that. Instead, we've basically had a blunt instrument that's, you know, applied to everybody universally. And, you know, I think about a lot of my clients, and when I read these and it said you have to do a risk assessment for every job task, I thought to myself, you know, I mean, good God, I'm not sure my employees even have or my clients rather, even have like a comprehensive list of every job task, right? I mean, when was the last time you sat down and made a list of every single job task that you have on your work site?
The other problem is that this was done at a time when we were all terrified that if, God forbid, we got it, we were going to die. I mean, that was just everybody's attitude. And now the reality is that they won't even talk about is what the survival rate is of folks who do contract it. And the survival rate is like 90, 95, 98%, because with all the new medications and everything else that come into play, but they haven't taken that into consideration with how severe all these regulations are.
Well, that and things like mask wearing has, the evidence has shown that mask wearing is actually highly effective, much more effective than we initially understood. So these regulations don't really take that into account much. I mean, they talk about masks, but, you know, at any rate, like I said, they are working to update them, and those standards will become permanent standards. So for what it's worth, anytime the Commonwealth or any government agency engages in rulemaking, those are public forums. So any business owner who wants to participate in this rulemaking, you can. The Goochland Chamber can. So, you know, you can go to the Department of Labor's website and, you know, they have public hearings on this. They had one just recently where you can lodge comments, you know, about the impact on of these rules on your business. You know, and I think that's important for all of us to weigh in. And, you know, we're all swamped and overwhelmed at times, but when the rulemaking happens without our input, we see what we get, right? So one of the things that I can do after this is I can give a link to Kimberly that people can use to go to the website where they can, you know, file a comment with the Virginia Department of Labor and Industry, and perhaps, you know, sign up to get alerts and things like that, so that you can give your opinion on the permanent rules before they get baked into the cake. So I'm looking at the comments.
Can we cry now?
I'm going to run a special for all of us to go to the Cayman Islands, and we can just relocate our businesses there, guys. This is crazy.
I'll sign up.
I mean, how in the world is the Department of Labor thinking that it's even going to have a reason to exist when how are we supposed to work like this? The small businesses. You know, I have part-time employees. I don't have full-time employees, and the bulk of mine are ICs. Yet, with that little minimum that I have, I still have to have something like this in place. Why in the hell would I ever want to go back to a brick and mortar? And even without the brick and mortar, I still have to have something in place. It's like, who's coming up with this stuff, man? It's like, come on down here to the working world, honey, and see what it's all about.
It's the direction they're headed. It's all across the board.
I mean, I'm telling you, the Cayman Islands have beautiful beaches. They're going to open up soon. So have I got a deal for you?
You need to know we're the only state that's done this.
We are the only state that's done this. I think here's what we're going to see. I think what we're going to see is relatively spotty enforcement of this. If you have an employee who complains, then that will probably institute, you know, kick off some kind of investigation, potentially. Absent an employee complaint, or, you know, maybe a complaint from a member of the general public or something like that, I suspect we won't see a whole lot of enforcement, in part because, as I think it was Stan said earlier, I mean, if you just go out into any business, almost none of these rules are being followed completely, right? And the Department of Labor just simply does not have the bandwidth to go, door to door looking for lapses in compliance. So I think we'll see some enforcement of it, but I think it's going to be relatively spotty. It's going to be concentrated on, complaints from employees or citizens. And I think if most employers make a genuine good faith effort to comply, and yes, it's going to take work to get through the plan and get your exposure risk assessment done and, do your training and that sort of thing. But I think if you make a good faith effort and if you communicate with your employees sufficiently to keep them not gruntled, then you will probably manage to get through this. There's no guarantee around that, of course, but I think the enforcement efforts around this are going to be concentrated on the egregious, really noteworthy non-compliance. Let's put it that way.
And that's something.
Headlines like.
I have another question for you too. If we had not registered for this webinar because we knew who you were and we know that you were going to dissect it for us, how would we have known that these regs were in place and that we were supposed to abide by them? Has there been communication to each business from the state, Department of Labor, whoever?
No. But then they don't have a legal duty to do that. So the way the state handled it is, so first of all, there's a public notice that goes out into, Virginia has a website called the Regulatory Town Hall. And anytime there's any kind of rule being made in Virginia, for any of the agencies, it could be VDOT, it could be labor, it could be, Health and Human Services, they post a public notice in the Regulatory Town Hall, that we're having a meeting on this. And so all of those notices got published in May and June and July when all this was being considered. And then, if you happen to know about it, then you could have participated in, public forums that were virtual like this one is, and weighed in. And then these regulations were approved on the 15th of July. And this almost made me tear my hair out, made my hair gray. But the regulations were approved on the 15th of July. And then the way they were worded, they said they will be effective when they are published in the Richmond Times-Dispatch sometime the week of July 25th. That's literally what the regulations said. And so I subscribe to the Dispatch, fortunately. So every day I go grab the paper off the stoop and I'm like, okay, is it in today's paper? Nope. And actually I think they published it on either the Monday or Tuesday of that week. I was hoping they would at least publish it on Friday, right? Like give us 4 extra business days. Nope, they published it on I think it was Monday or Tuesday. And it was in the sports section, which there are no sports going on right now, right? So who reads the sports section of the Times-Dispatch? So it was published on page like B2 or something of the Times-Dispatch on July 27th. And that's how we knew they went into effect. I kid you not. So, and there's been some news articles about these regulations, and I've been fussing about them and putting out videos and guides and blogs and posting on LinkedIn and like, hey, everybody, screaming from the rooftops. And it, it is what it is. So, any last questions?
No, I really appreciate this.
Me too.
Yep.
Wouldn't it be nice if we could just say, it is what it is, Inspector,
Right. Right.
We're trying here.
That would probably not be a good response.
We're going to tell them Tricia said that. We're going to say Tricia advised us. Yeah, it is what it is.
No, don't say that.
Tricia, you're amazing. Thank you. Thank you so much.
Thanks. So
Thank you,
listen,
Tricia.
I want to give this one thing before we all, adjourn here. I've given you a lot of information. And one of the things that we lawyers do is we work with each client to really learn the facts and the circumstances of your situation so that we can then advise you and that we can then actually take all this stuff I've just presented and tell you how it impacts you personally. That's really the job of a lawyer. It's why we're called counsel. And this is important, but if you have any questions coming out of this presentation, if it's not clear to you, how these rules are actually going to apply, I really urge you to reach out to a lawyer, whether it's me or, Eric Perkins, he's a great business lawyer in town, or, there are a bunch of good business lawyers in town who can help you with this. If this presentation has perhaps raised more questions than it's answered, or if you're not sure how it applies to you, before you just make decisions or take action, that's when you call your attorney.
And Eric Perkins is a chamber member and on today's Zoom meeting, so.
All right. That's
Thank
great.
you, Tricia. We appreciate you bringing this information to us, and we will continue to share it out so everyone can, you can share it on with other businesses and help get the word out. That's what we're trying to do as a chamber, is keep our members and our businesses informed. Thank you for doing that.
You're welcome. I'm happy to help and be a resource.
Okay.
All right. I guess that's the end of our time together today. Thanks, everybody.
Yeah.
Thank you, everybody. Okay.